Hi Pat, my name is Shannon Gray and I'm going to be doing your abdominal assessment today. Do you mind if I raise up your shirt?
Go ahead.
So first, starting with inspection, I'm looking at Pat's skin, looking at the color of his skin, making note of any nodules, scars, lesions, also the venous return, making note of even movement of respirations, the surface motion of the peristalsis, and also making note of aortic pulsation right in this area, which you can see a little bit on Pat's. Also making note that he does have some nevi, some different moles on here. So looking at those, making note of the border, the shape, symmetry, color, and duration of those. And then also it looks like he does have a few petechiae on his abdomen as well. And then next also, I'm going to have you go ahead and lift up your head. Perfect. And this allows me to check for any muscle separation, any hernias, any masses at that point. Also looking at his umbilicus, which is midline, it's inverted. Now I'm going to go ahead and auscultate the 4 abdominal quadrants, starting with that right lower quadrant, moving to the right upper quadrant, over to the left upper quadrant, and down to the left lower quadrant. Sound should be heard about 5 to 35 of them per minute. And what we anticipate is hearing some gurgling, some clicks. Abnormal sounds would be decreased sounds or increased sounds. So that would be below the 5 or above the 35. And then now I'm going to go ahead and listen right here. So for this, we're listening for the spleen, your liver on the right upper quadrant. And we're listening to hear any friction rubs or any bruits. And then also on that left upper quadrant, and almost, the spleen is really located underneath. So listening again for any bruits, friction rubs, which I do not hear. And then at this point, listening for the umbilicus, bruits, or venous hums. And then these branches move down to the renal and the iliac, and then the femoral arteries. Again, listening to both sides for any bruits or venous hums, which I do not hear. Next, I'm going to percuss the abdomen, percussing all 4 quadrants, listening for tympany. So everything should be tympanic on the abdomen. If it was not, then we get concerned about a mass, or possibly you might hear some dullness over an organ. So percussing all 4 quadrants, they are tympanic. And then now we're going to go ahead and percuss the liver border, starting at the right mid-clavicular line. So coming on down, making note from when we hear the tympanic sound to dullness. And then at that point, we go ahead and mark it. And then starting back up at that right mid-clavicular line, making that note where the dullness changes to resonance again, marking that area. And then at that point we will measure the 2 areas here, which should be between 6 centimeters, which that's what Pat's is. I'm going to go ahead and take off this tape. And so it can be between 6 and 12, and Pat is, his borders are normal. It's at 6 centimeters. And then now we're going to go ahead and percuss the spleen, which is just posterior to the mid-axillary line. So on that left side, and it should be dull. So again, it can be hard to percuss, but I'm going to go ahead and do the best that I can here. So finding that rib. I'm going to have you take a big breath in and hold. And now at that point we can hear, good, you can go ahead and breathe, that it changes from that dullness to resonance when he takes a big breath in, and that there's a movement there. And then now I'm going to go ahead and listen over the, or percuss over the gastric air bubble in the lower left anterior rib cage. So to do that, we're going to go ahead and percuss here. So again, what we're percussing for is it should be tympanic over in that, but it's lower in pitch than what we would hear on the 4 quadrants. So starting with light palpation, I'm doing this just to have Pat get used to my touch here. Any pain, tenderness?
No.
And then at that point, that hopefully will allow him to relax. So now I'm just going to move to deep palpation with the palmar aspect of my hand. Tell me if that hurts.
No.
And then when I'm palpating, deep palpation, I'm palpating that right upper quadrant at this point, which hosts the liver. And so I'm going to have you take a big breath in, feeling for that border, which I don't feel, but sometimes you can feel it, and that can be normal. You can breathe out. But just making sure that we define that border as well as if there's any tenderness or masses felt on that border. And then I'm also going to go ahead and move over here to that left upper quadrant, palpating for that spleen border, which is, again, it would be hooked underneath almost. But again, we should never feel the spleen border. So if we did, that would be cause for concern. And then palpating that left lower quadrant. And then if we're looking at McBurney's point, finding that iliac crest umbilicus about 2/3. So McBurney's point would be about here. And we could do a test to do rebound tenderness at that point also. The periumbilical area, so that should be in the umbilicus ring, that should be free from any bulges, nodules, or granulation. If I were to detect a mass, I would evaluate the location, the size, shape, tenderness, any pulsation, mobility, movement with respirations, which I do not feel. Now I'm going to have you go ahead and sit up, if you don't mind. I'm going to have you just kind of face, and then I'm going to have you turn a little bit here. Okay, perfect. So now I'm going to go ahead and put my hand over that right costrovertebral area, and then this, just tell me if you have any pain.
No.
Okay, and then again, we're going to change. Sorry, you may not be able to see this. Can you turn a little bit? Repeating it on the other side. So now I'm on that right costrovertebral angle, striking it with the side of my hand. Does that hurt?
No.
Okay, so he should feel me like bumping it per se, but he shouldn't feel any tenderness or pain, which you did not.
No, I didn't.
And this completes the abdominal exam. Thank you.